We are seeing pervasive and persistent disparities across the nation and certainly in our community. The highest rates of colorectal cancer are in the Black community. In the United States, a Black person is 20% more likely to have colorectal cancer than our white counterparts, and 40% more likely to die. This is a disparity that is systemic and requires a systemic solution. Systemic problems require systemic solutions that look at the conditions that lead to these results. So we've heard a lot about prevention. We've heard a lot about the important role of a proactive approach in staving off colorectal cancer. So when we're looking at a systemic solution and we're seeing a concentration in one population where those types of things aren't happening, we have to ask ourselves why. And the answers unfold very plainly in just the differences in the way that we move through very common practices in our day as it relates to health. We have very different realities within our community among people. So as it relates to proactive health care, some people have the latitude and the luxury to think very critically, very proactively about their care, and then they have the resources to do something with the information that they find out. Other people, as we know, who are living in the survival level of Maslow's hierarchy, are trying to survive, and they're dealing with their health care from an acute standpoint. They deal with health care once they're sick, and they're looking to get better, as opposed to health care when you're well and remaining healthy. We heard an example of someone who might have a constraint of taking off from work. For some people, their employment encourages them to take care of their health. Paid time off to go to a medical appointment is a common reality. For other people, taking time off from work to get medical care could only happen in an acute case where it was causing an absence from work. The idea of a preventative appointment that is not acute is really out of many people's reach. And then a very critical component that we look at as we work on health equity has to deal with trust between communities of color and the medical community. And this is something that is historic and has existed for many years. We often think that it's something that is ancient history, but there are a recent Pew study showed that 50% of Black Americans report a negative experience with their medical providers. We're so fortunate in our community. We have a medical community that is committed to ensuring that we have positive relationships with our physicians. This is not to castigate the medical community or to lay the feet on patients of personal responsibility, but to really underscore that this is a systemic issue that requires a systemic approach and must include partnership across all the stakeholders who can play a part in crafting solutions.